Hi, and welcome back to another episode of Queens Behind the Scenes. Today, we are getting into a topic that we do not talk about nearly enough: our bodies. We talk about our bodies, but not in this way. It's our health and what science is telling us about what we're experiencing, especially as Black women. I am so honored to have Dr. Sharrón Manuel with us today. Let me tell you, she's a powerhouse physician, scientist, educator, and advocate for reproductive justice. Dr. Manuel has dedicated her career to understanding our reproductive health, why we face disparities, and how we can take control of our health journeys. And she's my classmate, class of 97. We are both Wheeling Park Patriots, baby. So I am so excited to have her. Dr. Manuel, welcome to the show.
Thank you so much. You are so kind. I mean, when I got this opportunity, I just jumped at it, especially me being classmates and friends growing up. And I'm just
Yeah.
amazed that this podcast and anything I can do to advocate for women and their health, I will welcome that. So
I just
thank
love
you.
that. Thank you. Thank you. Well, let's jump in because you know that your journey is just as inspiring as your work. You've had a wonderful run. What inspired you to pursue women's health?
I think just as a med student, I would watch women be kind of matriarchs of the family. They advocated for their family's healthcare even more so than theirs, and were always kind of at that forefront, talking to their physicians and just mainly putting sometimes their family's health over their own. Also, I saw that connection with OB-GYN and how they just use them even as a primary care provider sometimes because they don't have time or don't
Yeah.
make the effort to have their own primary care physician. So you kind of act as the therapist as well as taking care of gynecologic needs. So I just, because of that and that connection, I really wanted to advocate for women's health and that's what inspired me to get into women's health.
That's amazing. My daughter's a nurse practitioner. She's in peds now, but she did her entire, before she got her master's, she did family care. So a lot of maternal health. So I always laugh because my daughter graduated in December of 2019. From undergrad at JMU, James Madison University, and she got her license in February, and it's 2020, and we know what happened in March of 2020. Right? She always said, I never knew nursing without COVID. Like she hasn't known it without like the medical field
That's
without it.
fascinating.
That's isn't that crazy?
Right.
It is. Well, let's go even deeper. I wanted to kind of set this table for the listeners. Dr. Manuel, you did your master's thesis on something that sounds a little intimidating to most of us. I know it did to me because I was trying to pronounce it all afternoon. Okay. I was like, I'm about to call it hyaluronic acid. I don't know what so it's called collagen, and you say the word.
It is hyaluronic. Even sometimes I trip up on the word, but hyaluronic.
Okay,
But
in the
hyaluronic
ovary.
acid is the same. They're all the same concept.
Okay. So hyaluronin in the ovary, right?
Yes.
Can you break down like what that means for us in simple terms? Because I literally just called it something that we put on our face. So break that down.
Interesting is I did this research at Northwestern under the mentorship of Francesca Duncan, and when we were looking at this research in particular, hyaluronic was really becoming popular on the market. So we noticed it in a lot of face cream advertisements as the anti-aging. It's also in our joint fluid just naturally. And so when they advertise to try to help build or rebuild or increase hyaluronin by taking glucosamine or other supplements for joints. That's what they're trying to recreate. And so it all goes with this anti-aging concept. And then the more hyaluronin you have in any type of material, the more moisture you bring in. And so we thought, hey, is this the reason why ovaries become more stiff and more fibrotic as you age? Is there something that you're losing hyaluronin, just like you lose it in your skin, that's causing that environment around inside the ovary or the ovarian tissue to cause fibrosis and aging. And so really a lot of people were looking at ovaries and the eggs in the ovaries or the
Yeah.
follicles and how that
Yep.
affects aging, but we were looking at the environment around those follicles. So follicle is just a sac that grows an egg. And so we're looking at the kind of stroma, and that's the surrounding tissue that surrounds all the follicles and helps them, supports them and helps them grow. So there's a lot of blood vessels, other things inside that stroma environment. So two things that we looked at were collagen and hyaluronan, and we noticed that there was an increase of collagen and a decrease of hyaluronan, leading to fibrosis in ovarian aging or aged ovaries. We saw that both in the mouse and the human. So really there's still studies trying to figure out how that impacts ovarian aging or the egg quality, the oocyte quality. Oocyte is just a fancy term for egg. But some thoughts are that stiffer environment causes you not to ovulate as well. And also the fibrosis kind of goes along with inflammation, and inflammation can potentially affect egg quality. So these are kind of all hypotheses that people I know are still working on, like Francesca and her colleagues. So really what people are trying to now target and look at is doing anti-fibrosis agents to help prevent that rapid aging or help slow down or delay that aging so that you can impact the ovary and potentially affect ovarian quality and preserve a woman's fertility. But again, all these things are still in the works and still
Yeah.
being worked on. But I know they have shown promise in the mouse models of showing anti-collagen treatments or collagenase, which breaks down collagen, will change that environment and potentially help with ovarian aging.
Yeah. Yeah. So why should women know about this? Like especially black women, because I think it's, you mentioned fibrosis and just like a lot of terms that I'm familiar with, but why would we need to know about this particularly?
Yeah, so I mean, really at this point, there's nothing you can do to stop ovarian aging. Some people have it more rapidly or early onset. If it's really early onset, what's known as premature ovarian insufficiency or POI, that usually happens and these are above. And
Okay.
so a lot of things underlie that or why people have that for different reasons, which I won't go into because that's a whole nother can of
That's a
worms.
whole other thing.
But really, what it is you just need to know about preserving your fertility because we're born with a finite number of eggs. When we're born, we have the most eggs that we're ever going to have. And then that egg, those egg numbers diminish as we age. And so once you turn 30, it starts to decline. But even at 35, that's when that peak starts to really rapidly decline. And so, really, you just have to be an advocate for yourself and know that your fertility is not infinite, it's finite. And so really being an advocate and talking to your provider about fertility preservation, especially if you're planning on having a family or just family planning in general, well, it's something just to be aware of because you don't want to get to your 40s and it's too late.
Right. No, I mean, I think this is so fascinating because I do love the way that you're making the science accessible because this is a part of what keeps people from asking questions. Like, you don't want to sound stupid. We
Right.
think it's too complicated, but it's our body. We need to be asking these questions. But sometimes you also just don't even know the right questions to even ask. I know for myself, especially, we're getting ready to get into perimenopause. And so I know I've been waiting for this. Listen, I just saw a thing perimenopause. Perry got hands. She be coming at you. She do. She does. She come. You think you having a good old day, and here she come, hot flash. I'm like, oh, we are for real. And so now let's get real with perimenopause because it's another thing that it was. Now I hear it all the time now, which is so funny. Like I never heard of it, but I will tell you, when I turned 40, and I am being very maybe TMI, but whatever. I turned 40, and that was the last time I had a normal period. On my 40th birthday, it was the weirdest thing. And so then they were sporadic, here, there. But then I started getting like hot flashes and night sweats and heart pound, all the symptoms
Right.
of it. And I didn't know what was going on. And, sometimes I get my period, I'd be like, oh, well, thank goodness, But even though my husband had a vasectomy, ain't nothing happening. But ain't nothing happening. But I was like, what is happening to my body? And so a lot of women don't know that, especially symptoms. You expect kind of like the period symptoms and maybe like hot flashes, but the heart palpitations, medications and the anxiety and all of that. So, first off, let's start here. What is perimenopause?
Right. So perimenopause just means essentially what it says around. Peri means around, so around the time of menopause. And
Okay.
so it's that transition period leading up to menopause. The average age of menopause is 51 in the United States, but people can have it earlier, women can have it later. And just with perimenopause, varies from patient or person to person, individual to individual. You can have symptoms, all the symptoms that you just described, the hot flashes, night sweats. You can have weight gain, mood changes, anxiety, depression, all these things that can really lead up to menopause. And menopause means, the clinical definition is basically the cessation of menses, or no period after 12 months. So after a year of no periods, then you're in menopause. So there's no test that we do for menopause. It's a clinical diagnosis. So once you tell me that you've stopped having periods, but not on any type of contraception or anything that would stop them purposefully.
Right. Yeah.
But once you naturally stop having periods after 1 year or 12 months, then that's essentially menopause. And so perimenopause can last anywhere from 4 years up to 7 years, or sometimes longer,
Yeah.
which people I don't think are aware of.
I know I wasn't. And listen, I have the works. Every symptom, I have the work. And I actually, it's funny because I have the works and I did go to the doctor. And, I think for me, it is important. My husband and I are moving, we're building a home, we're moving closer to our adult children. And I think it's really going to be important for me to have a Black woman gynecologist, because I remember going to my doctor and I was like, I had it. I was like, oh, I've had it. I cannot have another hot flash. I mean, who wants to be sitting there in a meeting and here you are looking like you about to die?
Right.
I mean, I'm like,
Right.
I can't keep doing this. So I went to the doctor. I was like, I'm finally going to just explore HRT. Like, I said that I wasn't going to do it, but it looks like there's been more research around, because at first a lot of people were talking about how it was so back in the day, like how it was not really good for you. Now they're saying it is okay. And so I said, oh, I'll go and I will look into that. And so I went to the doctor and he's like, well, first of all, I was completely dismissed. Like,
No.
Like I walked in, and now mind you, I was 10 minutes late, but it wasn't my fault. It wasn't my fault. It wasn't my fault. First of all, I couldn't find my doctor's office for some reason. Like, they had shut down some roads, and so it was like weird. So that made me on time. I was on time. But then the lady at the front played a game with my insurance card and was like, well, I need a new one. And I'm like, the new one is the same as the old one. Care First, Blue Cross Blue Shield, it's the same. The same. So that took forever. So when he finally got in the room, he was like, I said, I'm having, mood swings in this. He was like, yeah, I can tell. I mean, I was like, oh, so you getting smart. So then he handed
it's
me a
not
book.
funny, but that's reality of the situation.
It's the reality. I was like, oh, okay. And then he was like, he handed me a book that said, you're never too old for good sex, or good sex never gets old. That's what it was. Good sex never, some book. I was like, I didn't say nothing about I had a bad sex life. That's so funny that was so presumptuous, because that's just not my struggle.
Right.
But then he said, what I'd like you to do is go to our transformation something center for women. And I'd like you to look into this. I don't know even what it's called, but it goes under your skin and it's not FDA approved, but it's like some type of pellet that goes under your, I was like, I said,
yeah, I was like, if you ask me about that, I'm going to say, no, do not do that.
No, I am not doing well. So I made an appointment. I got my blood work, because this was the only solution offered to me, right? So I'm like, I'm desperate, and literally it got closer and closer. I never got the blood work done. Clear, when I know I don't want to do something, I do nothing to make it happen. So that's my pushback. Is like, I ain't doing that. So they called me to reschedule, and I said, I'm going to tell you right now, I'm not doing that. I said, I just need to explore some other traditional something. Not that it's not FDA approved. I know that there are things that aren't all the time, but it's not that. It's that, number one, you said it hurts, and I'm really not down for that. Number two, you didn't even listen to what was wrong with me.
Right.
You don't even know what's like, can you listen to my specific symptom? And so that's just not what I got. And so it is like just very frustrating. And so why is it for Black women, why are we experiencing the perimenopausal symptoms sometimes earlier and sometimes in a more intense manner?
Yeah, I think it's a number of factors. It can be socioeconomic status. It can
Yep.
be the fact that we face systemic racism, and even in the healthcare system at our jobs. Being kind of that matriarch of the family, like our culture is to be like the one that is doing it all, like the wife, the mother, being the physician sometimes at home,
Everything.
everything. And so a lot of that stress, and just dealing with systemic racism and those barriers can like kind of affect your overall quality, overall health. So I think all those play a role into it. And the fact that a lot of times we're not offered hormone therapy, or we don't, just as a culture, don't want to take it or accept hormone replacement therapy or just treatment in general. And so sometimes that can make the symptoms more severe, like, or just access to care makes a delay in diagnosis. And so
Yeah.
it's hard to really know. But I think all of those factors, nutrition plays a big role in it as well. And just lifestyle and environmental habits can play a role as well.
Yeah, and you, like you did say like the socioeconomic, because I noticed that with like even like diabetes too, like a
Mhm.
lot, and it does affect our community so much more and
Right.
so much differently, it seems
Right.
like. And it's funny because I was just telling my husband this because we with building a house, and the stress that comes. I mean, you a mom, you're a wife, you get it. And I don't know if you make your husband's doctor's appointments or not. You might not.
I do, because he's like, "You're the physician, so you're in charge of all
Okay, so
healthcare."
now,
Like, I'm like, that
it's
was
not.
not part of going to medical school.
That was not part of it. And well, I'm not a physician. I work in a whole different
But
field.
that's exactly what I'm saying. You're the healthcare provider, the healthcare advocate for the family. It's
Yes,
just it's
yes.
in a lot of families.
And I'm actually really glad my daughter is a nurse practitioner, because she sometimes now but she begins sick of it too. Like, no, look, like my brother was like, "Hey, find me a PCP." I mean, or no, my son said that to her. He said, "Find me a PCP." She was like, "What do I look like? Anthem?"
Exactly.
Google it yourself. And so I always said, I don't want my daughter to have to take over the things that I did. Like, but I still do make my husband's doctors and dentist appointments, because
Mhm.
we are family advocates we want our
Because
family to be
otherwise, they're not
healthy.
going to go. I know like my husband won't go unless I
He
make
won't
the
either. He
appointment.
won't either. He won't either. And I'm like, no, you're going. You're going. And so then what I'll do is I'll be like, we can go together, but then he don't want to do that. So he will go. I'll be like,
Right.
we can go together, because I'm gonna look at all the numbers. Look at all the numbers. So it's just wild. And I find that perimenopause obviously is something that now seems like the popular thing to talk about. Now, I don't remember nobody talking about perimenopause when I wasn't going through it. So maybe that's why. Maybe it's because I'm not going because I'm
And
going through it.
now you're hearing it all the time.
And
Exactly.
now I'm hearing it. And then I was gonna tell you, like, say, because you were talking about the whole year, like menses, like lack of menses for like a whole year. But aren't there ways to have like flash periods and stuff? And I wanted to ask about that. Like, what does that mean? Like you've gone a year and you don't have a period, and then one day you're sitting on a bench wearing some white pants and you have a flash period. That happens, right?
So if that happens, honestly, I would say irregular menses and perimenopause is normal. But if you hadn't had a period in over a year and are considered menopause, and then you have a period after that, that's considered technically postmenopausal bleeding and should be evaluated
So that
by
should
your
be looked.
provider. Yes.
Okay.
And then usually it's nothing. It's not cancer. That's the one thing we worry about, is endometrial cancer or cancer of the uterus, because
Yeah.
that's what signs of bleeding, especially postmenopausal,
Yeah.
can be a sign of. But you don't want to miss that. So I
Yeah.
would say anytime you haven't had a period in over a year and then you have bleeding after that, that's a need to get, or indication to be
To
evaluated.
be evaluated. Yeah. Okay. So now we know there's like a bunch of myths and stuff. Because I know so many women who are brushed off. I mean, we just told you about I just told you
Right.
about that. When we bring up these concerns, what are some of the misconceptions about perimenopause that you kind of want to set straight today? This is your platform.
Right.
Tell us the business.
So I would say one of the things is that HRT, or like you said, hormone replacement therapy, is reserved for menopause only. I would say that's a myth. I would talk to your provider about options because it's not reserved for only menopause. The thing with hormone replacement therapy, we want you on the lowest dose possible that will correct your symptoms for the shortest amount of time. So not all hormones are bad. That's another myth, that all HRT or hormone replacement therapy is bad. It's not. It's just it needs to be adjusted to your needs. And sometimes another myth is that you need hormones. It depends. If you're just having hot flashes, there are certain classes of antidepressants or other non-hormonal meds that are FDA approved that can actually help with those symptoms. So that's why it's very, very important to kind of discuss your symptoms with your healthcare provider. Another
Yeah.
myth, if you're going through perimenopause or menopause in general, is that your sex life is over. Like that book that you got just reminded me of that, and that's not in fact true. If you
True.
are having painful intercourse or having vaginal dryness, because that can go along with perimenopause, then talk to your provider because there's solutions to that as well.
Yeah, and low libido and all of those things. And I know I had, so I did not know this, which is a really, and you can tell me if I'm wrong, because girl, listen, I told you I ain't no doctor. But I did have one good thing that my doctor did tell me about, like vaginal dryness and things like that. Because listen, we're going through it and it happens sometimes. That's the biggest thing I hear is women scared to get dried out. So somebody told me like coconut oil is actually a natural remedy for vaginal dryness. Is that something that you would say is like, what's your feeling on that?
Yeah, no, that's totally true. And as long as you're not allergic to coconuts,
Right.
obviously. But yeah, no, we've told people that sometimes even people have recommended olive oil. So it just depends on um, what you can adjust to, or what, like, if as long as it doesn't cause irritation, then I think that's probably a fine to use that as a natural lubricant. And then there's obviously lubricants over the counter, um, things called vaginal moisturizers that are a little bit different. So that would, like, even the coconut oil, I think, would be considered more of a vaginal moisturizer than a
Mm-hmm.
lubricant. And then lubricants are for when you're having intercourse.
Okay.
So there's kind of different classes of medications that you could use depending on the need of the person or the individual.
I love that. Well, I know I want to thank you for the clarity because I know somebody
Yeah.
listening right now is feeling real seen. Me. I'm feeling seen. I'm like, oh my gosh. Well, we have got to go here because you know it's too critical not to. Let's talk about Black maternal health. The statistics are staggering. Black women are 3 to 4 times more likely to die from pregnancy related causes than white women. Help us understand why that's happening. I know you don't have all the answers, but you have more than we ever will know. So let us
Right.
know. Tell us.
Right. I don't have all the answers. I think some of it, though, I mean, a lot of times people will pinpoint, again, socioeconomic status, or environmental things. And so I think, yes, that can be part of it, but that's not all of it. And there has to be other reasons as to why we're seeing this. I think we tend to have more comorbidities, and that can be due to environmental things. Systemic racism also plays a role in it. And then just our culture not trusting the healthcare system and not seeking care quick enough, and not seeking the full prenatal care, being educated on the comorbidities, meaning other diseases that affect the Black community and how they can affect pregnancy, such as diabetes, heart disease. If you have a family history of any of those things, you're at higher risk because those things could pop up in pregnancy or even the postpartum period, meaning after you deliver. Time is critical. There, like, a lot of things can pop up, like heart disease and stroke, which people don't understand. So that long-term care, like through pregnancy and even after, and even several years down the line, as far as preventative care for diabetes, heart disease, other things that affect the Black community, stroke, depression, all those things need to be managed and cared for so that you even have a healthy subsequent pregnancy if you're wanting to have another pregnancy.
Yeah, yeah. And when we are navigating the healthcare system, what should we be asking? What should we be asking?
Well, for one, I would make sure that you know your family history. Know, is there depression in your family? Because that could put you at risk for postpartum depression. Not always, but it
It
could.
could, yeah.
Is there heart disease, diabetes, any of those things that go on in your family? Have you had glucose screens before that show that you could be pre-diabetic? Because that can play a role into gestational diabetes.
Yeah.
So knowing those things, or just even, or also being an advocate for yourself and just preventative care, so that when you go to the primary care provider and get diagnosed with certain things, you know all those diagnoses when you're trying to conceive, and even going to what we would call preconception counseling, knowing your risk before you conceive. So one of the things patients don't know, both Black and other ethnicities, is that obesity plays a big role in affecting your pregnancy. So it can increase your miscarriage rate. You don't realize it's rare, but it can also affect malformations of the baby growing inside of you. So a lot of
Wow.
times it's recommended to even get to an ideal weight before conceiving, because once you get pregnant, we don't obviously want you rapidly losing weight, because that can also affect the
The
pregnancy in a
baby.
negative way. So
Yeah.
I would just say really advocate for yourself, knowing your comorbidities or your risk for them, and then really getting I guess a comprehensive care managing team. So you may need an endocrinologist to be playing a role, like if you have diabetes, to also be in conjunction or speaking or in communication with your obstetric or your OBGYN, your obstetrician, during your pregnancy. If you have a neurologic disease, like you have a seizure disorder, you want your neurologist in constant communication with your obstetrician, because you could be at risk for a higher or really a lower threshold to have seizures. So your medicine may need to be adjusted.
Adjusted.
And just knowing kind of how to optimize that pregnancy, I would talk to your provider about that, about nutrition, things to avoid during pregnancy, and just be really educated about those things.
Well, how can we build our care team to protect ourselves and our kids? Like, how do you build that?
Really, just I would say knowing and being educated about all those things that could affect your pregnancy, knowing about prenatal care. I think one of the good, like, I wouldn't recommend Dr. Google, because they don't always give you
Girl,
the right information, but there are
Dr.
definitely
Google.
reputable websites. What we were like, oh, they went to Dr.
Dr.
Google.
Google.
But there are reputable websites online, such as the American College for Obstetricians and Gynecologists, which is known as ACOG, which is the governing body over obstetrics and gynecology. They have a for patients section. And so a
Hmm.
lot of the prenatal care things and steps and during each trimester, things that you should be looking out for, things that you should be doing, how often you should be having your prenatal visits is all in there. Women should know before they even think about pregnancy. Anybody of reproductive age should be taking adequate folic acid and just basically a multivitamin, but most multivitamins or prenatal vitamins have an adequate amount of folic acid in there. If you have a seizure disorder on certain medications, you actually need more. So that's why it's important to really know, list all your medical concerns, and I would say even write questions down that you come into, because you may forget them when you go in to see your physician. Because a lot of times, I know with the hustle and bustle and then just the stress of having to see multiple patients in a day because of insurance needs and income, etc., sometimes you do feel rushed in the visit. And so really just making sure that you have those questions written down, and things that you need to ask to advocate for yourself are important. Knowing the good pediatricians in the area and having a pediatrician in place beforehand before you deliver is a good idea. And again, I mean, just knowing research and word of mouth. I know a lot of people in our community like to see others like us, so they are looking for Black physicians, and not to say that there's anything wrong with a non-Black physician, but a lot of times just doing your research and knowing that you have an advocate that is going to look out for you is important. So really getting to know your physicians, getting to know the physicians in the area and the specialists, because if you need a specialist such as a neurologist or a cardiologist, those are all important things. And so really knowing your comorbidities, knowing your risk is kind of how you build that care team, because if you do have heart issues or things going into, you may need to be with a cardiologist. So you have a cardiologist and the obstetrician working together. if you know that your baby has complications, sometimes you see a high risk doctor or what's known as maternal fetal medicine. And so they're in conjunction with and sometimes you see both them and a general OB-GYN, which is fine. And they work together, as well as like having a neonatal team if your baby is going to need neonatal care when they're born, or say that we're predicting they may be born early, then those are all things to kind of look at, and knowing what hospital has that level of care that you're going to need.
Wow, yeah. That is powerful. The care team concept is like such an
Mhm.
empowering way to think about our care, not just being passive about it, but assembling like the right support
Right,
even proactively, as you
right,
were just saying. I know that I had gestational diabetes when I had two of my kids. I had three pregnancies. Two of them were, I had gestational diabetes. And so that makes you at higher risk of type 2 diabetes as
right.
you get older. So knowing that definitely have been, I think I try to do better. When you know better, you do better. And so with like, I feel like growing up, I did not learn. I mean, your dad was a doctor. I mean, so you like you had medicine in your family. So that is like I didn't have anybody telling me like what to do. I was eating all booty corn fed, everything. I am eating all the food, okay? But no one was telling me. Now that I'm older, I have my own children and I have the means to be able to make smart choices and feed my family and myself. I do make different choices because I just don't think that that was something that was really discussed when
Right.
I was younger. And so now I'm like, okay, I had type 2. So now I'm trying to like manage my diet a lot better. I eat, I work out. I never really saw that when growing up. I mean, I didn't. I ran track, but my brother played football, but it wasn't something like my kids can say, I see my mom go to the gym all the time, right?
Right,
Like I didn't see my mom going to the gym all the time. I love her, but she wasn't going to no gym. So,
right.
so, that is that. You are though truly on the forefront of what is next in reproductive health. You really are. And I am so proud of you,
Thank
obviously,
you.
as a classmate, as a childhood friend. Let's talk about some of your current research specifically around endometriosis. What are you seeing in that research and what gives you hope for future treatment?
So right now I'm working with Dr. Katie Burns at University of Cincinnati, and we're really trying to pinpoint non-invasive strategies to diagnose endometriosis, because right now the gold standard is surgery. You have to have
Yeah.
surgery in order
Yeah.
to prove that you have endometriosis through pathology. And so a lot of times that delays diagnoses and delays treatment. So we are really looking for non-invasive ways in order to diagnose this. And a lot of, I can't say the details because a lot of it's patent pending and
Yep.
protected, but we are finding things that are popping up that look to make it promising that we may be able to do this. And it's our hope that we would have a mechanism to have like even a home test where the patient could do it in the privacy of their own home. My hope is that will actually break the racial disparities and disparities in the access to care, because right now we obviously have a huge problem with patients accessing care and getting to the physician. And so with the home test, if you're just doing it in the comfort of your own home and getting it sent in and getting the diagnosis, that may provide you with a quicker diagnosis and a means to then quickly get treated.
Yeah, yeah. And for women who may be facing premature ovarian insufficiency, is there promising research or treatments on that horizon?
I think there are things on the horizon that's still a ways away, but there are things that are looking promising. A lot of things are looking towards ovarian tissue cryopreservation, meaning freezing pieces of ovarian tissue prior to losing that ovarian reserve or that egg count. And
Yeah.
so, if you're proactive about it and freezing that tissue, it's a possibility that that tissue could be reimplanted at some point, and then act as hormone replacement therapy or even delay menopause. However, I think the transplants are still variable in the amount of hormones or eggs they produce that produce those hormones, because the egg is what the supporting structures around the egg is what is actually supporting and producing our hormones to kind of keep us balanced. And the main hormone is estrogen, but also progesterone that help kind of keep that female balance. And those are what diminish during menopause. And so I think there's promise with that. There are a lot of companies and other places that are kind of advertising about ovarian preservation or treating menopause or delaying menopause, but I think the technology is still lacking and it still needs to be more advanced before those things can really get out in the market. But even as I was saying before, the mouse studies with looking at the anti-fibrosis with the ovary has been a proposed mechanism. There's other or other researchers that are also trying to engineer ovarian follicles and grow eggs in vitro, like meaning outside the body, that could potentially be implanted and put into the body. There's some stem cell research. So I think there's a lot of promising things. They're just kind of still being worked out for technology and being able to translate to real live experiences.
Well, this is the hope we need.
Yes.
I mean, it is that it does look like hope because so many women suffer in silence, thinking this is just what it is. But science is moving, and I know I am one of those women who's like, especially because it seems like back in the day, and I don't know because I wasn't so aware, but I asked so many women in my family, I'm like, when did you go into menopause? Well, I had a hysterectomy. When did you go into? I had a hysterectomy. I'm like, did anybody go?
Right.
And it seemed like people was just giving out hysterectomies left and right, And so it is great to have science moving and people like you who are invested and committed and passionate about women's health. As we start to close out the conversation, which honestly I could keep going forever, you have my number. We're about to stay in contact because I am so admired by you, but also you're cool, and whenever you're in my area or whatever, I just want us to be able to link up. But I want to leave the queens with some action steps. So what would you say to the woman listening right now who feels dismissed or confused about her symptoms? What can she start doing today?
I would definitely advocate for myself. Make sure that you're kind of keeping a diary or a journal of your symptoms. And if you feel dismissed, then get a second opinion. Definitely don't stay and just go with what that person says. If you feel dismissed, then you're not comfortable with that physician and you may not be able to really go along with their treatment anyway because you're not, that trust is lacking. So really find somebody you trust. Sometimes word of mouth is the best way to find a physician.
Yeah.
Or just even their reviews. Sometimes I will say, like, an irate or angry patient will write a bad review on that one. So I wouldn't just go by the one bad review. But I mean, sometimes it goes, unfortunately, you have to go through several doctors till you find that one that you connect with. But I think a lot of physicians do feel rushed with just kind of the pressure of how the system and electronic medical records is working, all this documentation, all these other things that are kind of pulling at us in different directions. But we still have that time to at least have some good bedside manner and have some compassion and really try to listen to a person or an individual's complaint. So I would say make sure that they're listening to you and that you feel heard. It's not always about hormonal therapy. Again, like there's other mechanisms to treat your symptoms depending on what they are. Sometimes you do need hormones and not all hormones are bad, but just really advocate for yourself is what I would say.
Okay. Well, before I let you go, we have a little fun here.
All right.
At Queens on the Scenes. So I'm going to throw out some quick rapid fire questions, just whatever comes to your mind first. They are super fun
Okay.
and nothing crazy. Okay. Morning person or night owl?
Definitely a night owl.
Okay. What's one thing that you always keep in your bag?
Definitely my lip gloss and my lotion.
Yes, the girl lotion for sure.
Yes.
What is your go-to comfort food?
It's hard to say, but I would say usually it's Chinese, but lately it's been Chipotle because my 15-year-old loves Chipotle.
They
So
do.
she
The
talks
kids love
me
it.
into going to it a lot. Like it's at least once a week, at least.
So it's funny because my kids love it as well. What's your favorite way to unwind and recharge?
I would say I'm a spiritual person. I'm a Christian. And so really just kind of speaking to God, reading my Bible, and then joining in corporate worship at church, I think is really kind of my way of recharging. Especially like I hate when I miss a Sunday because that Sunday kind of just sets the tone and sets my mood for the rest of the week. But if I do have to miss it, then just praying on my own and just kind of having that quiet time to meditate is really what recharges me.
Great. If you weren't in medicine, what would you be doing?
Oh my goodness. So it's so funny. I would probably be entertaining. I like did dance and theater my entire life, and I tried to join. I think it was like I forget what it's called, the Great Americans or somebody that came, some group that came to our high school or our junior high. Actually, I think we were in high school, and they allowed us to audition. But the thing is, they like tour all over America doing these dance and singing things at different schools, but you don't get paid, so you have to have like a side gig. My mom was like, absolutely
Absolutely
not.
not.
You need your education to fall back on.
Yeah,
But
absolutely
yeah,
not. Yeah, that was a
absolutely.
setup, girl.
Yeah.
That was a setup.
But no, I love the theater. I love so I mean that may or probably something behind the scenes with production or something like that.
Okay. Most underrated piece of health advice.
Um, I would say nutrition focus. Like I think a lot of times patients, especially if you have a weight problem or obese, I think they just don't realize how much obesity is an underlying disorder for a lot of other things like heart disease, diabetes.
Yeah.
And so I think just really focusing on nutrition, even more so than exercise. Exercise is also important, but what we feed our bodies, where we fuel our
Hmm.
bodies, really kind of is the foundation for our overall health and just have maintain that healthy weight because especially central obesity in middle age has a high risk of heart disease, metabolic syndrome, all those things kind of tie in together. And so really knowing that obesity is a horrible disease that kind of leads to a number of other diseases is very important.
Yep. What's your dream vacation spot?
Anywhere with the beach. So I want to go to
Okay.
Punta Cana. I haven't been yet, but
You
I've been to
haven't?
Jamaica.
It's great. You
I
will
love
love Punta Cana.
Jamaica, but anywhere there's water, I'm there. Sunshine and water that I can just chill out and relax.
You will love Punta Cana. We go every other year
Really?
on Thanksgiving for Thanksgiving. My whole family goes. My mom. It is so fun. We stay at the Hard Rock, and the reason we stay there is because out of all the places we've stayed, they've had the better food, and it's all inclusive, and the kids go, and it's huge. But just a recommendation:
Nice.
song that always lifts your mood.
Well, so I'm gonna give you a Christian song and
Okay,
then
and then a
and
trap
then a
song.
non-Christian song. My Christian go-to is Kirk Franklin. I smile. I love that song about because it just reminds me to like always smile no matter what's going on.
Yep.
And then my kind of theme song, if I'm getting ready in the morning, I'm not like I need like pumped up, is I Look Good. Exactly. And blasting and
Yay!
look in the mirror.
I was hoping you ain't say Marvin Sapp with the way he was trying to hold them people in that church.
No, I heard about that, but I have not seen it.
I did see it. Close the doors. I was like, okay.
No, my
Okay.
mom told me about that. I have not
I bet
seen
she
it.
did. It's on social media. It's crazy. What is one word to describe Black women's resilience?
I'd say enduring. I think we endure a lot, and our strength kind of shows like the fact that we endure things like systemic racism at the job, and not only as African American or Black. So we have the racist part, but we're also female, so then there's another minority that you have to kind of break those barriers over, and just it just shows our strength and resilience that we can continue to break those barriers despite being mistreated or misunderstood or undervalued even.
Yeah.
So I think endurance or enduring would,
And that is speaking to my soul, honey,
yeah,
because because it is, that is, we do endure so much. I always say, because of the intersection of being Black and being a woman, we're not white and we're not men, so it's almost like this weird space. We're not in the damn weird space, everybody else is in the weird space, and they don't know what to do with us. So
right.
enduring is exactly right. Well, last question: what is one thing you wish every woman knew about her body?
Say understanding the menstrual cycle. I think even in med school, we didn't even understand it enough. I really didn't fully understand it till residency, and then even more so as a reproductive specialist. And so I think a lot, and then like when our patients, as adult patients, come to us, and you realize that they don't even really know their body parts or how it works. And even despite you even explaining how like the in vitro for like for instance in vitro fertilization, we go through this whole kind of concept or like progress of how and discuss the process when they come in
Mm-hmm.
as a new patient. I don't know if they just are so overwhelmed that they forget or they don't understand, but sometimes the questions they ask, you could tell you didn't really understand this process of how it works. So I think just really knowing your body and really understanding how your cycle works and like what's shedding, like you're shedding that uterine lining every day because or every month, not every day, but every
Yeah,
month.
no, not
Yeah,
that.
hopefully not every day.
Every
If you
day.
are doing it every day, that's a problem that also should be
Needs to be true.
evaluated.
Yes.
But just realizing that that's because you if there's no pregnancy there, that's how you shed it. And just like knowing the hormones and like what's playing a role when. And I think by knowing that, you really understand how the concept of pregnancy works and how ovulation works. And then you realize when things are abnormal.
Yeah. Yeah, for sure. Well, I love all of that and thank you for playing along.
Yeah.
And more importantly, thank you for sharing your wisdom with us today. I am so appreciative. I messaged you, and I got to tell this audience, I messaged Sharrón. Now, I'm going to call you Dr. Manuel because when a Black woman is a doctor, you best believe you getting doctor from me, okay? Dr. Manuel she's my Facebook friend because we are childhood friends and we went to high school together. And so I messaged her and she responded to me. And clearly my brain was somewhere else because it was weeks later. I was like, oh my God, she said yes. Oh my God. Oh my God. I'm like trying to, so I am so thankful. You have truly blessed us today. So thank you for your brilliance, your passion, and for standing in the gap for so many women. Queens, if this episode spoke to you, please share it with your sisters, your aunties, your friends. Let's make sure we all get this knowledge and make sure you join us next week for another powerful conversation. Until then, keep wearing your crown boldly. Bye, Queens.